Thank you for the opportunity to speak on behalf of European Forum for Primary Care. Based on international evidence, a number of policy recommendations were developed to support improvement of primary care for getting more cost effectiveness of healthcare systems and to get more equity in health. Demographic aging and the increasing prevalence of chronic diseases in the community creates a challenge for all countries in the region. More resources are needed, and they need to be better allocated to address changing needs of health care. Increasing multimorbidity, patients having multiple chronic diseases will confront primary health care even with more challenges. The combination of increasing health needs and demand from more informed patients requires strengthening of primary health care characteristics such as person-centeredness, continuity, first contact care, comprehensiveness, holistic modeling. Moreover, all countries in the region face shortage of professionals in primary care due to decreased interest of medical students to choose family medicine. Countries should develop systems that stimulate 50% of medical graduates to choose primary health care. That needs to be included strategies that all medical students have early exposure with primary health care. A strategy to make that happen, and also for nurses, that nurses should be changed in order to give them more capacities to work in primary health care more independently with patients. This requires their increased roles in modification of patient perception and behavior. Also, systems have to be changed towards more integrated, capitated systems. How are we going to address these challenges? Most countries have adopted a disease-oriented approach through vertical, disease-oriented programs. This may lead to fragmentation, duplication of interventions, and especially it fails for patients with multimorbidity. What is needed is fundamental paradigm shift from disease-oriented towards goal-oriented care, taking the goal of the patients in the term of quantity and quality of life as a starting point for the intervention. And very often goals of the patients are related to functional status or social participation. Authorities should develop incentives to guarantee high-quality primary healthcare services, empowering patients, and focusing on person-centered and goal-oriented care. Most fundamentally, this will also require dialogue and communication between the health sectors and people in need of health care, involving different stakeholders in society. European Forum for Primary Care works in this direction and calls for strong collaboration with other networks and institutions. Next year, it will also gather in the Baltics for a conference in Riga on the connection between informal care and professional primary care, 4th, 6th September 2016. Welcome.